A little housekeeping. I'm Aaron Levo. I'm the Vice President of Communications and Public Affairs. Happy to be here to moderate today's town hall. We will have the question and answer function on today, so you can type questions into the Q&A function at the bottom of your screen. As our panelists are able, they will answer those questions and they'll accumulate under the Answered tab. So you can see the response to your question in the Answered tab as we go. Ask a question at any time, and if at the end of today's town hall, your question remains unanswered, we can email you back an answer from one of our experts or panelists with us. So just make sure your name's attached to the question so that we know who to send it to. And as always, after the fact, you can email questions to our hhsnews@hhsc.ca inbox, and we'll have that information up again later in the town hall. We will leave time for celebrations at the end. We'll reserve our chat function for our celebrations, so please keep questions in the Q&A. And we'll keep our celebrations in the chat function. And so think of those things as we get to the end of our agenda. We'll pause to celebrate for a moment. Okay, that's enough out of me. I'll hand things over to our President and CEO, Rob McIsaac, to kick things off. Rob, over to you.
Thanks very much, Aaron, and good morning, everyone, or I guess good afternoon. And thanks, as always, for joining. As is our tradition, I'll begin by acknowledging that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So this is our first town hall together as an EPIC hospital. Amazing. The last time we met 2 weeks ago, we were just 2 days away from go live. As you know, this feat was more than 2 years in the making. It involved the effort and input of thousands of folks from across our organization, and really is by far HHS's biggest achievement in our 25-year history because of how transformative a project this was. So here we are. 12 days of EPIC under our belts. I know it's been a real learning curve, but I have to say, I'm so impressed with how our teams have embraced the change. We knew that there would be delays and glitches after go live. And so far, our course has, I think, been pretty typical for an implementation of this scale. We know from our partners at EPIC, they are reassuring us that we're making good progress. And so I can only credit each and every one of you who has risen to the challenge of continuing to provide safe care while simultaneously navigating a massive change to the way you work. I want to extend my appreciation, especially to the Project Odyssey command team, which has been supporting clinical teams through these issues 24/7 since we launched. It just wouldn't be possible for this ship to be sailing without you. So right now, we're really focused on getting to know and stabilize our use of this new system, and it's still early days. That said, just by launching EPIC, we've been able to get a brand new view into the way we do our business. We've never had this level of insight before. Before, so much of our data and information was just a piece of the picture, and now as we get deeper into using EPIC, we are increasingly seeing the full picture of operations here at Hamilton Health Sciences. We've already identified some near-term improvement opportunities based on some of those insights that we're gleaning from EPIC. In the coming months, as we become more proficient, we'll start exploring how we can make even better use of the system to improve how we work and provide care. We're really just at the beginning of a very exciting and promising journey. So once again, thanks everybody for making it possible. You're doing awesome work, and it's appreciated more than I can say. I'll leave it to Dr. Lum, who has been such a great leader on this project, to provide a more detailed update on EPIC in just a couple of moments. Before we do get to that, maybe just a reminder that June marks two very important observances. June is Pride Month, a reminder to recognize and celebrate the impact that LGBTQIA+ people have had across the globe. And June also marks National Indigenous History Month, which highlights the rich history, heritage, and diversity of First Nations, Inuit, and Métis peoples in Canada. Shannon Kitchings from HHS's Human Rights and Inclusion team will speak to both observances later on in our agenda. Now I'm going to turn it over to Dr. Lum, as promised, for an update on EPIC Go Live. Barry, over to you.
Thanks, Rob. Hi again, everybody. I am going to reiterate a couple of things that Rob said, so bear with me. Just on behalf of the Odyssey and the EPIC team, the level of support that the organization has provided to our team has been nothing short of spectacular. We could not possibly have gotten here without all of the incredible commitment of the organization. So we say it over and over again, but we mean it every time we say it. And that is, we can't thank you enough for all the work throughout this very, very challenging time. And look, no surprise, there's lots of issues. It's not easy, as Rob said, to mount a project of this size. And so we are doing our very best through a very structured command center process to deal with the issues as they come up. We prioritize them, and I want to assure you that they are all cataloged and they will all eventually find their way to a resolution. The help desk and the team is working 24/7. I've had the opportunity to be in here both day and night, and the level of energy at the command center is truly amazing. These guys are working so hard to help you get comfy in the system. In terms of your support, we want you to remember that there are many lines of support that we can provide you. That includes your super users, which are our own, of course, staff who are extra fully trained in the system. We have our help desk, we have the ticketing system, and you'll hear a little bit more towards the end of my comments about how we're enhancing the opportunity for virtual support as we move now from the high intensity sprint of the first days to more of a paced activity. Next slide, please. So where are we today? The go live actually went pretty much as expected. There were some tense moments just before go live. We had lots of our senior executives here in the command center with us. The teams are adapting well, and I don't want for a minute to imply that it's easy. It's not, and we recognize that, but we are hearing, and as Rob said, we are now starting to already see the opportunity for efficiency. People are commenting that they can see the future and that it looks bright and that the quality of our care will be able to be enhanced. The workflows are starting to come into a pattern where people can figure out how they're going to do their day. And obviously our paper charts have mostly gone away. There are thousands of tickets. We're in the range of about 12,000, maybe even closer to 13,000 tickets. And you'll see in a minute that the team is doing a spectacular job of staying on top of them. A cool call out, you all know about MyChart, which is this incredibly powerful patient portal, and we have over 2,000 registrations for the MyChart portal already. Next slide, please. So just a few comments and a few numbers to throw at you to just kind of re-emphasize the magnitude of what we have been through. You'll see at the 1 o'clock position there that of that massive number of tickets that I told you about, that 10,000 of them have already been resolved. We now have a single source of truth in the organization for a patient's clinical care. We have been able to take advantage of the interoperability characteristics and power of EPIC with over 35,000 records shared. We have deployed 1,550 rover devices, and over 40,000 secure chats already taking advantage of the internal communication power of Epic. Next slide, please. So you've heard us talk about the command center, and I just wanted to just briefly touch on this. So we have this very sophisticated process that begins at the sites and at the various clinical programs that eventually gets funneled down and distilled into what we call the top 10 at 3. And each day the team carefully reviews the issues as they come in, and we create a priority. And each one of those then gets intense activity because we, having identified these, know that that means that they are sort of a type 1A priority and they need to be dealt with. So here's an example. They change every day. And I would tell you that what we saw last week versus what we're seeing this week is already showing that we're getting into a more stable organization in terms of our ability to function in the Epic world. So this is something that happens every day, is reviewed very carefully every day, and updated every day. Next slide, please. So a few reminders for you. I can't emphasize enough how important the ticketing system is for us to be able to follow all of these concerns that may be raised. I'll mention this a little bit more detail later. But please don't forget, if you've got a concern, take the opportunity to enter a ticket. It's not difficult, and it allows us to stay on top of things. Omnicell, which is this very sophisticated way of dispensing medications to our patients, which is really one of the absolute keys for our improved safety and quality, is now up, and we have gone off the override system over the last 48 hours, and to date, that seems to have been successful. I would remind you that MyChart codes for patients under 12 are not going to be easily available. Our downtime procedures for administration of blood products was a very significant challenge in our first week. And I'm really pleased to say that over the last 3 days, we're feeling like we can successfully provide blood and blood products to our patients. And of course, there are very important processes that are required within the Epic system to allow for patients' movement across the organization, whether it's from unit to other hospital, or even from our hospital to another hospital. All of this continues to be available in our long list of tip sheets and workflows that you can access on the hub anytime. Next slide, please. So in terms of ticketing, I did say how important this is, and what this is meant to show is that the more detail you provide in the ticket, the more our team is going to be able to provide you with a satisfactory response and resolution. So it's all about providing that information, copying it to a manager if you're submitting it, so that both individuals can have follow-up, and we will follow up. And I will tell you that we have a policy that the team will try to contact the individual submitting the ticket for 3 consecutive times. And if at that point they can't reach you, they will close the ticket. You will be notified, and you most certainly can resubmit if they've not been able to contact you after that. Next slide, please. So improving support, and again, we know how hard this is. I don't want to minimize it for a second. So we have, in addition to the supports that you heard about previously, which includes the at the elbow support from super users, the help desk, the ticketing system. We are ramping up our ability to provide you with virtual support through that phone number. You will get an expert in the Epic world, and they will have the ability, if you're on an HHS device, to actually take over and show you on your screen how to accomplish the workflow or the concern that you have. So I just want to thank you for your understanding as we modify our support system. I think you're going to find that it will continue to evolve, and our people on the floor will get better, and the virtual support will also be a big advantage. Next slide. So at this point, that's where we're at. And we, of course, encourage you, please go to the hub, find out all the information as it evolves, and don't be shy at any point to contact us. Thanks, Aaron. I think that's it for me.
All right, thanks very much, Barry. Great update, great work by the entire project team across the organization, as Rob pointed out. Really remarkable what we're accomplishing. Okay, so next up on our agenda, we are going to have an update on our remote work policy. And with us to give that update is Patty McEwen, our Director of HR Operations. Patty, remote work, what do we need to know?
Thanks, Aaron. So I just first wanted to start by thanking everyone for their hard work and flexibility over these last 2 years. We started working remotely out of necessity with the pandemic, but we have taken the opportunity over the last couple of years to assess how remote work might fit into how we do work here at HHS. And I'm happy to be able to share today that the new HHS remote work policy is finalized and is available as of this morning in the policy library. So I just wanted to spend a couple of minutes today giving some very high level information about the policy. I'd encourage everyone to have a read through it, and you'll see that we'll be working through the summer on some of the details on how we implement this as our new future state remote work. So the key in this policy here is that we're looking to move towards a hybrid model, which would really involve, for those who are eligible for remote work, it would mean that your schedule or the amount you're working remotely is the majority of your time, and that there will be regular in-person touch points with your leader and your team. What those look like, the frequency and the nature of those meetings is to be determined at a more local level. So that will vary depending on what your team needs, what type of work is done, and that's something that we'll be working with leaders on over the summer. So speaking of that, in terms of timing, I'm speaking about the summer as July, August, in order to do some work to prepare for in-person return. And I don't mean in-person return full-time, obviously, because that's not what this policy covers, but an in-person return more than we have been these last 2 years in September. So what we're trying to do over July and August are a couple of things. The HR team will support leaders in confirming eligibility for individuals and teams, determining what a hybrid model looks like for each team, and eventually working to have employees review, understand, ask questions about the policy, and then, like we do with a number of other policies, there's a sign off of understanding. Over the summer, we'd also be looking to employees to return any furniture that they may have borrowed. I know some of us took home, say, chairs or keyboard trays. We'd be looking to return those back to your home site so that we can ensure we have the equipment available for when people return on site. And then we'd also be looking for individuals to take home their personal items that were in their previous desk space. So again, all of this will be discussed with your leaders and as a team. This isn't meant to be the only information you receive. Obviously, people will have questions and will want to talk through this. There is a lot of planning still to happen, so we'd ask that you're patient with us and with leaders as we work through this over the summer, and we will be communicating and keeping teams informed of how things are progressing towards a more hybrid model of in-person and working remotely over the summer and into September. So as I mentioned, the policy is now available in the policy library. Following the town hall today, this afternoon, there will be a communication that comes out, and also an FAQ document that we hope will answer most of your questions. And that'll be sent out to employees working remotely, as I said, later this afternoon. So I'm sure there will be lots of questions. Feel free to reach out to your leaders. I will attempt to answer anything in the question and answer today. But for now, I will send it to Tiffany Roblin, who's our Director of Employee and Labor Relations, for an update on another policy.
Thanks, Patty. As I mentioned, another kind of brief policy update for folks today. On June 2nd, our disconnecting from work policy came into effect for all employees at HHS. This policy flows from our obligations under new provisions of the Employment Standards Act that were passed late last year. While recognizing that HHS is a 24/7 essential service operation, we strive to promote the health and well-being of our employees, including that healthy work-life balance. We encourage folks to review the policy on the policy library. It is there now if you've not done so already. It is designed to outline expectations for employees and encourage staff not to engage with work-related communications outside of working hours. You'll note the policy does contain certain exceptions, such as where staff members may be scheduled on call, those emergency situations, and so forth. You may be familiar with these exceptions as they are not new to many of us. We recognize that every team position and of course individual is different. And so as you read through that policy, you'll understand that. Leaders are encouraged to also set and reinforce these expectations amongst their respective teams. And the approaches or strategies may vary, like we've said, across those teams, those employee groups, and depending on the role that you hold with the organization. So very similar to what Patty has said, should you have any questions, please reach out to your leader. There'll also be a staff memo issued shortly along with an FAQ document that will be posted to the hub. And once that is released, we do encourage you to seek those resources as well if you do have additional questions. Of course, if there's questions today, I'm happy to answer those as well. With that, I will turn things back to Erin.
Thanks very much, Patty and Tiffany, for the update on those policies. Next up on our agenda, we have another member of the Human Resources team, Shannon Kitchings, who's our Human Rights and Inclusion Specialist, to talk to us a little bit about Pride Month. I'm noting personally the wonderful backgrounds that both Patty and Tiffany had, which I was looking for in our standard backgrounds. Well, Shannon has it too. Maybe one of you can email that to me. That's some good stuff. Anyways, Shannon, what do we need to know?
Thank you so much, Erin. So happy Pride, folks. June is Pride Month, a month observed by many countries around the world to recognize Two-Spirit and LGBTQIA+ community. It's a time for learning and celebration. And to help with that, we have published a Pride calendar of learning opportunities to help you mark the occasion. You might be familiar with our calendars from the past, so we have a new one out for this month. And in it, you will find a variety of books and films and webinars and podcasts that can help you and your families celebrate this month and learn more and grow with our community as well. You can find it on the hub, and I hope you enjoy. Please feel free to provide any feedback on it. Also, June 23rd at noon, we will be launching a Pride Affinity group to make a safer space for staff and faculty and physicians who identify within the Pride spectrum to connect with one another. If you would like to join, or if you're interested and have questions, feel free to contact me at kitchings@hhsc.ca or the inclusion inbox as well. And next slide, we are also observing National Indigenous History Month, as Rob said at the top of the meeting. And we invite you to return to the calendar of learning we made last September, which you can also still find on our hub for more learning opportunities as well. And there are other resources located there for support and learning and education about First Nation, Métis, and Inuit people. Also, if you visit our Employee and Family Assistance Program, Homewood Health, you'll find some additional learning resources there on Indigenous history within Canada. And I also would just like to pass on that there is a huge library of films by and about Indigenous people located in the National Film Board. They're free to access, so you can check their website out if you'd like to observe or celebrate something else as well. And we also have Indigenous Peoples Day coming up on June 21st. HHS will be marking the occasion with a special menu item honoring the day. And I will be screening the film The Unforgotten, which is a short film about health disparities amongst First Nation, Métis, and Inuit people. It's a really beautiful storytelling piece. It's about a half an hour long. If you'd like to register and join for that, please, again, reach out to me. Thank you. Back to you, Aaron.
Awesome. Thanks very much, Shannon, for all that information. So as always, just letting everyone know if you had a question that was raised and answered today, that's great. If you have a question that you didn't get to ask, you can always send it to hhsnews@hhsc.ca as an opportunity for you to get an answer. Just make sure that you send it from your work email, preferably, so that we can send you back an answer promptly from one of our experts. Okay, so I note that we are closing in close on time, but we do have a bit of an opportunity for celebrations, which I think is really important. We've had an incredible amount happen since our last town hall. So I would encourage our panelists or our attendees, you can type something into the chat forum and I'll read it out, or you can raise your hand and give your shout out live. So Dave McKeag, quickly out of the gates, I see you with a hand up. What could you possibly want to celebrate today?
Well, funny. So I think there's been lots of thanks and celebrations in general and to teams, but I just wanted to take a second to encourage everyone to basically to celebrate each other, that there is an opportunity to thank those that have helped through, I know it's been a very challenging time. It's a challenging time in healthcare to begin with, and coinciding the epic go live in this space has been an additional extra challenge. And yet I've seen so many people and been out to some of the sites and be able to hear firsthand what they have been able to accomplish. And one of the things you hear is teams learning together and helping each other. So I would just encourage everyone to perhaps navigate to the hub and take a look under perks and recognition and the STAR program and send a STAR e-card. There are epic STAR e-cards available at the moment. And, I've received STAR cards before, and they really are just kind of a nice, it just kind of brightens your day and it's a thanks to your peers that may have been able to help you to accomplish something. So anyway, just an encouragement to take access to those and send them out to your peers. Thanks, Aaron.
Awesome, good stuff. Thanks for pointing that out, Dave. For sure, a great way to give recognition beyond our time here today. Leslie Gillies, I see you with a hand up. What would you like to celebrate today?
Thanks, Aaron. 2 items. June is Seniors Month, so lots of great stories to share on the hub. So if people want to check that out, just a reminder about that. Also, very busy, intense week, obviously, for everyone at HHS, but in specific recognition for the support that was provided by the EPIC team and HITS and pharmacy in collaboration with the clinical programs at the Satellite Health, St. Peter's, West Lincoln, and UCC. Tremendous progress made this week and lots of resolution of printer, Wi-Fi connectivity, armband, Omnicell, which really supports our patient care improvements. And thank you for all the hard work.
Awesome. Thanks very much, Leslie. And I know here from Susan Fucciarelli, shout out to the EPIC Help Desk, EPIC team, and IT folks for getting our printer issues resolved in employee health services to allow us to continue providing service to our employees. Thank you. All right, well, I'm going to leave it there because I know everybody is racing off to their next meetings. I'll turn it over to you, Rob, for final remarks. See you guys next time.
Thanks, Aaron, and good job as always. Thanks all for joining us today. We'll continue on with our town halls. Just encourage you to watch for the notices for when they will be. And thanks for coming today and for your engagement. Very much appreciated. Have a great rest of the day and a great rest of the week, everybody.